So the inflammatory response is generic. Regardless of the mechanism of tissue injury, the inflammatory response is going to have the same physiological cause and the same clinical manifestations. So different causes, but one type of inflammatory response. It's always the same type of response, but there are different causes. So let's think about some of these causes now. Now, the first group of causes are mechanical. Physical trauma can obviously cause inflammation. So if tissues are cut or crushed, or if there's abrasions and scrapes, or if there's friction, or if there's pressure, all of these mechanical things can cause tissue injury, therefore can lead to an inflammatory response, mechanical causes. But inflammation can also be caused by chemical effects as well. So for example, if you get alkalines or acids in your eyes or on your surface of your skin, that's going to damage the tissues, therefore there will be an inflammatory response. Or maybe you've had like heartburn where you've got acid reflux. If that's bad enough, it's called gastroesophageal reflux disease and can cause ongoing inflammation inside the esophagus because of the acids in the stomach, the hydrochloric acid and the pepsin, the digestive enzymes, causing irritation in the esophagus. It's a chemical effect. Or you might have come across patients with pancreatitis, where digestive enzymes are actually released into the tissues of the pancreas, causing autodigestion and very significant inflammation. Or you might have come across patients with peritonitis. Perhaps there's been a gastrointestinal perforation and gastrointestinal contents have leaked out into the peritoneal sac, causing extreme pain and the life-threatening condition that is peritonitis. Or maybe once you drank too much alcohol and the next morning you had a sore stomach because the alcohol inflamed the lining of the stomach, causing a temporary gastritis, an alcoholic type gastritis. So lots of chemicals can lead to inflammatory responses that we can learn to recognize clinically. So there's mechanical causes of inflammation, chemical causes of inflammation. The next causes are thermal, and that's quite obvious. When the tissues are too hot, they're going to get burnt, and when they're too cold, they can get frostbite. So thermal causes of inflammation, too hot or too cold. So mechanical, chemical, thermal. The next one we want to look at is infection. When there's infection in a tissue, whether it's bacterial or viral infection, that's going to stimulate an inflammatory response, partly because it's going to stimulate the immune response, but also because bacteria can release toxins into the tissues, which directly damage tissues. So infection, any sort of infection, can lead to inflammation. And it's particularly important clinically that we can recognize an infected wound, for example. We might see heat, pain, redness, swelling around an infected wound, and that's what tells us it's infected. And of course that's going to influence what we do clinically, because we can clean this wound and we can give antibiotics. Or maybe there's been infection in the pleural membranes as a result of a lobar pneumonia that you've come across, and there's pleurisy, and it really hurts. It's like a knife sticking into the patient's chest every time they try to take a breath in, because the inflamed pleural membranes are rubbing together, causing pain. And of course pain is one of the cardinal features of inflammation. So mechanical, chemical, thermal, infection. The next one is radiation. Radiation can directly damage tissues. For example, ultraviolet radiation from the sun can burn the surface of the skin. Now, unfortunately, if there's radiation involved, the inflammatory response is often delayed. So the patient can sit there in the sun for hours and feel fine, and it's only that night that they start getting the inflammatory response and the pain, and they realise that they've got what can be quite significant sunburn. So radiation as a cause of inflammation as well. And inflammation can also have an immunological cause, caused by the body's own immune responses. So for example, in autoimmunity, in autoimmune disease, there can be an inflammatory response. That's what causes the pain in rheumatoid arthritis, where you get inflammatory changes in the joints. Autoimmune disease. Diabetes type 1 is an autoimmune disease where you get inflammation in the pancreas that progressively destroys the body's beta cells in diabetes type 1. So immunological reactions can be autoimmune. But we can also include allergic responses under immunological responses. So in allergy, the body is reacting to some antigen. Antibodies made by the immune system are reacting to allergens or antigens from the environment, generating allergic reactions. And inflammation is a key indicator of allergic reactions. So mechanical, chemical, thermal infection, radiation, immunological. I think we'll include two more. Ischemia can cause tissue damage. Therefore, when the ischemia abates, there can be an inflammatory response. So ischemia can cause an inflammatory response, although because the inflammatory response does depend on blood flow, very often that inflammatory response is not that obvious, at least in the initial stages. And the other time you can get inflammation is around about necrotic tissue. Now, the necrotic tissue itself is dead, therefore you're not going to get an inflammatory response actually in the necrotic tissue, but round about it you can. So the inflammatory response is the same, regardless of the cause, but it can be caused by mechanical insults, chemical insults, thermal insults, infection, radiation, immunological reactions, ischemia, and necrosis. Many different causes, but one type of generic inflammatory response to those various tissue insults.